Hello beautiful people and welcome back to my channel. If you're new here, welcome. My name is Anava and I make faith related and medical related videos. Welcome to another summary of my rotations video. I have made these videos ever since my first department. For those of you who may not know, I am an intern doctor currently practicing in Zambia, and I have made summaries or reviews of my different rotations in all my departments. I'm currently in my last department, which is pediatrics, which is going to be this video. But if you'd like to see my reviews stroke tips for my different departments, then you can go ahead and check the playlist. I'm going to put it up here. But without wasting any more time, let's get straight into today's video. For those of you who may not know, pediatrics is the medical specialty which focuses on children, and that is where I have been for the past 6 months. Like I said, I have completed all my other departments and I'm officially at the end of the road for my internship, but I'm not going to get into that in this video. Over the next few weeks or months, I am going to make videos in relation to that, but right now this video is specifically for pediatrics. So I am in pediatrics. I have been here for 6 months, and all in all, it's a good department. Like, I won't even lie, it's a good department. It's not for me, but it's a good department. I did enjoy my stay here. It wasn't the worst, it wasn't the best, but it was just fair. I know there are some people who are passionate about pediatrics, and I have seen the passion, but like I said, it's just not for me. In this video, I'm going to be getting into the pros and cons of this department, and at the end of it, I'm going to be giving you 5 tips like I usually do if you're about to join this department. Without wasting any more time, let's get into the first pro. So the first pro that I have, which I think is the best part of pediatrics, if I could say, is that children have a very good bounce back rate. Like, a child can come in severely ill. You can see a child come in such a state, and then you intervene as a medical practitioner. You give medication, you give fluids, you have to give fluids, you do what you need to do, and the child is going to bounce back almost instantly. You can leave a child when you go home at night and think, oh my gosh, that's the worst, that child was really sick, and you come back in the morning, the child is up and running and playing and everything. They have such a good bounce back rate, and I think that's the best part about pediatrics. Second other thing which I really loved about pediatrics is that children cannot fake their symptoms. Like, a child cannot fake their symptoms. If they're sick, then they're sick. If a child comes in and they're drowsy and they're low, then that child is genuinely sick, because naturally children are going to be running up and down and be playful. It's very hard for a child to fake their symptoms. Maybe if they're a little bit older, like maybe the teenage years. Disclaimer, pediatrics in the facility that I work at is from 14 years going down, 14 years old going down. So maybe like 13, 14-year-olds, maybe they're able to fake their illnesses, but it's very hard for a child to fake their illness as compared to adults. Adults can just like fake this or fake that, or say, oh, I feel this, I feel that, but a child, it's very unlikely that they will fake their symptoms. If they are sick or if they're showing you a certain symptom, then majority of the time it is probably genuine. Another thing that I loved about pediatrics is that it has a very good job satisfaction rate. Like, you're able to get immediate gratification from treating your children. A child will come in and you see the state of the child, you see how worried the parents are, you see the illness, and then when you intervene as a medical practitioner, you treat the child and the child gets better. You see that immediate gratification because you see the child running around the ward and being okay. You see the parents relaxed and calm. You get that job satisfaction because you feel like you have done your job as a medical practitioner and you have seen the other side of that healed whole child. One of the biggest cons, it could be a con or a pro depending on how you look at it and how you feel about pediatrics, but one of the biggest cons for me was pediatrics is a whole vast arena of medical information. In med school, for some strange reason, you'd want to believe that pediatrics is a little medicine, like internal medicine, but just condense it and put it in a child. But it's not. Like, pediatrics has its own pathologies, it has its own illnesses that you don't even see in adulthood, or you don't see majority of the time in adulthood. It has its own symptoms, it has its own pathophysiology. Like, it's a whole other arena of medical illness, and you have to reread that, you have to restudy all that. Like, you would think it's going to be like a little medicine where like what you know in medicine just kind of apply to a child, but no, you actually have to go and dig deep and start studying and knowing the stuff. So for me, who wasn't really the biggest fan of pediatrics, I'd say it's a con because I had to go and start studying again. But if you love pediatrics, then that is a pro for you, because that means you're going to you have so much to read and so much to learn. And if you love pediatrics, like I said, you're going to enjoy that. Another con that I have is that peds is very sensitive. It is rather sensitive. Like I said, when a child comes in and they're very sick, like there's so many factors that come into play, social factors, economical factors, as to what got this child to the state that they're in, especially in the setting that I am working in. Children are innocent and they're very fragile, and you just feel bad that that child has to experience that. Not that it's not bad when adults experiences it, but I think it's just 10 times worse when a child is experiencing it. Like, I remember, for example, I had a child who attempted to commit suicide. He drank rat poison and he was about 12 years old, and it just broke me. Of course, when that happens in an adult, it's a horrible thing for someone to get to that place. It's really, really horrible, but it just really, really broke me that such a child would want to do that. Like, what is he experiencing that would make him want to do that? So I think because children are so fragile, they are tiny, like, you have that natural protectiveness of children. When you see them go through certain things, certain illnesses, like, it just makes things worse. So in that sense, pediatrics is a little bit more sensitive than internal medicine or other departments. Another con that I have is in regard to patient autonomy, the fact that parents have the final say over their children. That is a positive, of course, but then it can be a con when it is played in the wrong way. And what I mean by that is, maybe you have a parent who is rejecting your medical advice. If a child has certain illnesses and you advise this and they don't want that, maybe the child has severe anemia and they don't want the child to have a transfusion, maybe the child is severely malnourished and they don't want the child to be put on F75, F100, maybe they want to just feed the child their own thing, but then they're not feeding the child a healthy diet. Like, they have the final say, or they have control over their child and the way you're going to manage that child, and that is a negative thing in a certain regard. There are some parents who are going to comply with what you're saying. They're going to listen to your recommendations. They're going to do the best for their child to get better. They're going to buy the medication. They're going to go far and beyond, and you'll see the benefits in their child. But there are some parents who won't necessarily go with the medical advice that you are given. For example, I had a child who was admitted to the malnutrition ward. The child was severely malnourished, had TB. On top of that, was HIV positive, was not started on treatment, and the child came in very, very sick, very, very wasted, low immunity, and the mother was worried about leaving her husband at home because of other women or something, leaving the husband alone at home. And the child was with us for about 2 weeks or so, and after 2 weeks she just ran away with the child. Like, she just disappeared with the child because she was like, I can't leave my husband alone at home for that long. Of course, there's child services, there's all that other stuff that gets involved, but it's just heartbreaking that such a person with such wrong priorities is going to have autonomy over a child. There's a woman who believed that her children, if they're sick, do not need to come to the hospital. She healed them with herbal medication and all that stuff. And by the time she brought the child to the hospital, the child was so ill. Unfortunately, the child even demised in the hospital. But like, just the fact that parents have autonomy over their children at home, and they are the ones who make the decision of when to bring the child, and sadly some parents actually leave the hospital against medical advice, that is the sad part of pediatrics. But they are the minority. It's not a lot of times that you get such cases, but just when it does happen, it is a very sad situation. One thing that I forgot to mention under the pros is that pediatrics has got a very low workload in regard to the fact that you're working with children. It's just easier to work with children. It doesn't feel like such a burden. If I have 10 internal medicine patients here and I have 10 pediatric patients here, for some strange reason, although the numbers are the same, it's just going to be easier to work with the pediatrics patients. Maybe it's the atmosphere. When you enter the ward, when you're around children are joyful, they're playful, they pass silly comments, you laugh. Like, the atmosphere is just nice. Maybe it's just the atmosphere of pediatrics, but it doesn't feel like so much of a burden if I have to say like a whole bay, as compared to internal medicine. If I have to say a whole bay, it's like, okay, I don't know how to explain it, but that's one thing I did enjoy about pediatrics. Alright, so now I'm going to get into the tips that I have for you for the pediatric department. I have 5 tips, and the first tip that I have is that you should remember that in pediatrics you have 2 patients. In other departments, internal medicine, general surgery, ortho, urology, obs and gynae, in majority of these departments you have 1 patient. Obs and gynae comes close because in obstetrics you have 2 patients, you have the mother and the child, but majority of those other patients you always have 1 patient. But in pediatrics you have 2 patients. You have the child who you're caring for, who you're managing, who you're diagnosing, who you're treating, and then you have the parent who is a worried parent who you have to relay with, who you have to relate the information that you are working with, your diagnosis, your treatment plan that you are actually going to be communicating with. And that is why pediatrics is a very unique department, because you're working with 2 people. So the tip that I have is that when you're working with a child, you need to be a bit more playful, you need to be a bit more open, you need to be able to interact and speak to the child and get them to open up to you and actually tell you what they're feeling. The mother can tell you, oh, my child is coughing, oh, my child has a fever, but only the child is going to tell you that, oh, I'm having chest pains. Or the child is going to tell you that, oh, I'm having abdominal pains, because that is not something that the parent is going to be able to tell you unless the child has actually told the parent before that. So you need to be able to speak to your child. Of course, you do your clinical examination and you do your tests and you make your diagnosis, but you need need to be able to speak to the child and maybe pick up something that may have been missed that only the child can tell you. Where does it pain? Usually it pains here in my fingers, it pains here in my hands. Your alarm bells are going to go off that, although the mother is saying that the child is having swelling, the child is reporting pain in the fingers, let me test for sickle cell. Like those are certain things that have to come into factor, and you get that from how you're going to be with a child. If you're going to be a bit stern and rude, a child is not naturally going to open up to you, gravitate to you, and tell you certain things. But if you're a bit more playful, if you speak to them at their level, they're more likely to tell you more things. In regard to that, when you're speaking to the parent, you need to be able to keep the parent calm, but still give them all the information. You need to tell them about the child's condition, you need to tell them about what you're recommending, and you need to tell them about the child's prognosis. You need to be able to keep the parent calm on one hand, and on the other hand, to be able to effectively communicate what exactly is wrong with the child and what is the way going forward. The second tip that I have is that you have to practice your cannulations. Guys, practice your cannulations, because cannulating in pediatrics is a beast. If you can cannulate in pediatrics, then what is an adult? Honestly, like for me, when I joined pediatrics, I started in neonatal ICU. So in neonatal ICU, neonatal ICU is where you have like the severely critically ill babies, anyone below the age of 28 days, and you have the premature babies and everything. Like, can you imagine having a 1.3 kg baby? Like, imagine how small that baby is going to be, like that tiny, and then you have to cannulate that baby. Like, guys, it's not for the faint-hearted. Worse off, imagine like you get like a chubby baby, like maybe 7 months old, and they're like, those chubby babies, like a chubby baby and veins are nowhere to be seen. Like, you really have to have your cannulation game on point. Whether you cannulate visually or you cannulate by anatomy, you have to have your cannulation game on point. Another thing is, sometimes you get a patient who comes in, maybe they have severe diarrhea, severe vomiting, and they're severely dehydrated, or maybe they come in shock, and a cannulation is the line between life and death for that baby, because you have to get fluids in that body. So a cannulation is literally the line between life and death. So you need to have your cannulation game on point. You need to know how to put, if the veins, if they're in shock and all the veins this side have kind of like constricted, you're unable to access them, you need to know how to put an intraosseous line like directly into the bone and just push fluids, like cannulate. Know how to cannulate those babies. My third tip is that you need to learn neonatal and child resuscitation. You need to know the parameters. You need to know what to do when you need to resuscitate a child. If a child comes in shock, like I mentioned, you need to know how much fluids to give. For example, we have 3 different levels of dehydration. We have no dehydration, we have some dehydration, and we have severe dehydration. According to the WHO guidelines, we do have shock, and the management for all these degrees of dehydration is completely different. So you need to know that. You need to know how you're going to resuscitate your child who is in shock, how much fluids you're going to give per kg, over what amount of time are you going to give those fluids. You need to know how to do CPR. You need to know how to do chest compressions. You need to know how to give CPR, because you won't do the normal adult, they're tiny. So you usually use your thumbs. In a little bit of an older child, you use one hand. Maybe you can go to 2 hands if they're bigger. So you need to know all that. You just need to know all that. Know how to resuscitate a child, because it differs from resuscitating an adult. You need to know how much adrenaline you're going to be given, the dosage of the adrenaline. You need to know all that. And that takes me to my 4th tip, which is you need to know your drug dosages, how much you're going to be giving the child per kg, and your drug contraindications. So in pediatrics, every drug that you give is given per kg. It's not like medicine where majority of adults have a standard dosage for drugs. If I'm going to prescribe an antibiotic, majority of the time it's going to be a standard dose. Maybe it's going to vary in the severity of your disease, but in pediatrics, it's actually per kg. So what you're going to give a child that weighs 8 kg is not the same that you're going to give a child that weighs 27 kg, because the body mass is different. So you have to know your drugs per kg. You need to be able to prescribe all the different medications that you're going to be using per kg. You need to know what is contraindicated and when it is contraindicated. There are some drugs that are just outright contraindicated in the pediatric department. You cannot prescribe such a drug, that is just for adults. There are some drugs that are maybe contraindicated until a certain age. For example, if you want to deworm a child, you cannot give mebendazole to a child that is less than 2 years old, but you can give albendazole. Same line of drugs, same treatment options, but then you need to know that this one has to be given because of this child's age. So you need to know what drugs are contraindicated, and you need to know how much of those drugs are going to be given per kg. The last tip that I have is a little bit of a funny one, but you need to be careful. You need to take care to not get infected by these little babies. I have a running joke with a friend of mine in pediatrics, and we always say, like, when you go to OPD, you do pediatric OPD for 1 week and then you go back to the ward. So when you do your pediatric pediatric OPD, like the week after that, you will definitely have some off days because you're sick. And it's kind of like a running joke, but it is actually very true. Like, these kids are highly contagious. They're highly infectious. Majority of infectious diseases that you see in children are viral, number one, which are very easily transmitted, and also number two, they are not the most hygienic patients. Like, a child, you will not find a 1-year-old who knows how to cough and cover their mouth. Like, they'll just cough, you know. Like, if you're not careful, you will actually get a lot of flus and upper respiratory tract infections during the time that you're in pediatrics. So you really have to purposefully take precautions. When you're sending to the chest, look the other way, face the other way. Don't go too close to the child's face. Like, the child is going to touch you, play with your hands when they're sticking their fingers in their mouth. Like, just be very careful because they are not the most hygienic patients. Okay guys, so this is the end of the video. Like I said, this is the last one in the series. All the others are already going to be in the card up there. You can check them out on the playlist. But yeah, this is the end of my rotation review stroke tips videos. Let me know if you have watched all my videos from internal medicine through to surgery, ortho, uro, obs and gynae, and now pediatrics. Let me know which department, according to the reviews that I give, is suitable for me. I'd really like to know that. Like I said, more videos are going to be coming with me ending my rotation, me ending internship, me progressing to being an SRMO, and maybe even going into specializing. I'm going to definitely keep you guys informed on this channel, but I have officially come to the end of this road and I'm so happy. So yeah guys, thank you for being with me. If you've watched all the videos in this series, thank you for being with me. If you are joining PEDS or you are already in PEDS, let me know what other tips you have. You can put them in the comment section down below for other people to read. Thank you so much for watching this video. If you like more faith and medical related content, then please do subscribe to my channel. Thank you so much for watching this video, you guys, and I will see you in the next one. Bye.